Right, so the government all along has been talking about the universal healthcare coverage, but do we have enough health personnel to ensure that this becomes a reality? The health sector has faced several shortages within some specific areas when it comes to surgeons in the industry, when it comes to doctors in the industry. Has the reason as to why also, early last year, we also saw the government bring in doctors, Cuban doctors into the country to help the local doctors, which caused a lot of uproar. But what is the cause of the shortage of health workers in the country? Is there a need to encourage Kenyans to take, the health training? Talking to us about this is the CEO of the Kenya Medical Training College, that is Michael Kiptoo, who is actually with me here in our studios this morning. Thank you so much, Mr. Kiptoo, for talking to us here on KTN News Center. When you talk about, probably health shortage in the country, we are simply talking about professionals in the health sector. But in the health sector, which areas have so far been affected when it comes to shortage?
Thank you very much for hosting me this morning. When we look at the health sector, really the issue of shortage is not there. What is happening is that we are looking at equity in terms of distribution. You'll find that the health professionals are more confined into cities. For instance, Nairobi, Mombasa, and all these cities. If you go to the far-flung regions of this country, you find that most of the doctors who graduate from our universities will prefer to work in the cities because of the social facilities available. So really, we don't have shortage in terms of health workers. We just need to look at the equitable distribution of these health workers. The other area that is also key is that as Kenya Medical Training College, we produce more than 85% of the health workers in this country. Again, when you look at the various cadres, like last week on Thursday, we were able to graduate 12,621 graduates into the job market. Really, if you look at those cadres, we had the highest being the nursing with 4,552, plus now the others in clinical medicine, followed by pharmacists. So as an institution, we are able to produce the numbers required. But the question we should asking ourselves is, where are these numbers going to?
In fact, I was about to ask you that, because producing a lot of numbers when it comes to health professionals in the health sector, but the absorption becomes the concern. Because after all those years spent in training, where do we go to next?
I think we need to look at when you look at the health sector, we have not reached the optimum required numbers. If you look at the WHO classification in terms of a health worker to the patient numbers, we are still below. So what is happening is that, yes, we have the trainees and graduates outside there, but we are not able to absorb the number that is required. Again, this could be related to the economy as a country, that we may not be able to absorb all the numbers. And if you look at these numbers, you find that we need to think outside. As a training institution, what we are looking currently and discussing so closely with our parent ministry, which is the Ministry of Health, is to look at these numbers and say how many can be absorbed by the county governments, bearing in mind that health has been devolved. So the issue of employment really lies with the county governments through the public service commissions within the counties. So there is that structure which need to be fully streamlined so that we know the exact numbers that we have there. But having said that, we need also to look at a scenario where, as a country, we should also be able to export these well-trained Kenyans who have the skills and competencies. It's the same thing that we are doing. If you look at the nurses, for instance, they are all from KMTC. If you go to Canada, you'll find them. If you go to UK, Australia, Botswana, South Africa, you'll find a number of KMTC-trained graduates working in those countries.
But is it because we are doing a lot of exports of our health professionals, into other countries? Is it because of lack of absorption, or it's mainly contributed by poor remuneration? Because that is something that health professionals have been crying about day in, day out, especially nurses. And then you also have the clinical officers.
Thank you for that. What is happening is that it is twofold. One, you talk of lack of absorption, and you look for greener pastures. Two, you look at in terms of remuneration, if you a nurse working in the UK will probably be earning more. But what we should be looking as Kenyans is that, yes, if we have these people working in the other countries, UK, America, and so on, what kinds of returns are coming back to the country? Because you look at the economy, they contribute a lot as terms of diaspora, which is now leading even more than in the tea industry, for instance. And that now brings back again revenue. So we really need to look at both sides of the coin so that we're able to say, yes, we have trained these people. How many do we really need maximum? We can absorb those ones fully, and we make sure that we have enough of them. And then now the rest who are able to get, and that's why I'm talking of, if we have a structured way of actually exporting these people, we'll get more benefits rather than the way it currently is.
But then, Mr. Kipto, then it begs the question. We have seen several students, of especially students, the nursing students, clinical students, clinical officers, and also lab technicians, being given internship in several government referral hospitals. Let's talk about KNH. You've seen some of them being taken to the county government hospitals. But then at the end of the day, when they finish the internship, they're not easily absorbed. And like the doctors, they have that, let me say, about 70% assurance that when I finish my internship here, I'll immediately be absorbed.
When you look at the nurses, just to zero in on one of the cadres, and even clinical officers, they're actually about, we can also be talking about 70% who gets really absorbed into the various health facilities within this country. We are talking of about 30% who now will seek not only we need also to look at the private sector. We also have quite a number of them going to the private sector. Some are working for pharmaceutical companies, especially the pharmacist technicians. You will find that clinical officers, they have also been provided with skills where they are able to open the facilities where they can have private enterprises. And that goes a long way in ensuring that they are also able to create economies and also employ other Kenyans. So there's that angle which probably is not being looked into, but that also absorbs a certain percentage of these people.
All right. So how achievable is the universal healthcare coverage if all the trained health professionals are not being absorbed into the job market, especially in the health sector?
The achievement of UHC, universal health coverage, is achievable because we have the human resource. There are specific cadres. Because when you talk of UHC, the main thing is that you are looking at access, affordability, and all this can happen only when we have the human resource capacities. Now, when we talk of primary health care, which is really the core of UHC, is that we are looking at people, nurses who have been trained at the community health skills and competencies, which we already have the training ongoing. We are working currently with other partners. We are working with AMREF, we are working with St. John's to ensure that we develop all these cadres required at that community level, because that's where we want to start and talk of prevention. So the ministry, jointly with us, we have put in structures. We have even developed specific courses in family medicine, because now we are looking at, you want to take care of the family. If you take care of the family, then you also reduce the number of incidences which could have occurred. And you can only have the linkage with that so that we can have clear database in terms of household. And that's where the zeroing in of UHC is going to happen. But
then zeroing in of the UHC is going to happen. And I believe especially residents within the counties that have been termed like located in the urban settlement. Look at Nairobi County government, Nairobi County, look at Mombasa County, look at Kakamega County, Kisumu County, Nakuru County. These are counties that are placed in the prime regions in this country. But look at counties in the northeastern region, in the Rift Valley region, the interior parts of this country. Yet, when we started this conversation, you said that so many health workers really do not work in these remote areas. So it begs the question, will UHC be easily be achieved in these counties that are in the far-flanked areas of the nation?
What I can tell you clearly is that UHC will also be achieved in those counties. For instance, what we have done is that we are working closely with Beyond Zero, which is being spearheaded by Her Excellency, the First Lady, Margaret Kenyatta. And we are working so closely with World Bank. And what we have done is that we have already trained 1,200 who are specifically from those remote areas, West Pokot, Mandera, Lamu. And those are what we are referring as enrolled community nurses. And these are people with the understanding that as soon as they graduate from our institution, they'll go back and work within the communities. And the first lot which graduated in 2018, I can give you, like in West Pokot, the numbers who came from West Pokot have all been absorbed by the county government of West Pokot. And this is also happening with the other counties. So what we have also done as an institution is to ensure that we have people from those counties being trained. And if you look at how we are situated as KMTC, you find that we have expanded. We are now currently in 43 counties. We have a campus in Mandera, which is going to serve that region and ensure that also we are able to train people from Ethiopia and also from Somali. And those are the cadres who will be able to work within those environments. Of course, if you look at that, we have to look at homegrown individuals who should be able to go back and support their communities.
All right,
and with that strategy, I strongly believe that we'll be able to have the numbers.
But then it begs the question, you know, as much as we're talking about churning out enough, health professionals into the Kenyan market, and not so many of them are being absorbed into the market when it comes to employment. So where you sit from, is there a need for the government to actually sit down with some of the health institutions like KMTC, institutions like UN that are offering health courses, to say this is where the gap is? So when you're absorbing students who want to get into the health sector, this is the number that you're supposed to take in, because there has been a lot of concerns in terms of government bringing foreigners to do the work that even Kenyan health professionals can actually do.
I do agree that we need to look at the numbers clearly. And if you look at the Ministry of Health, we have already an agency, which is Kenya Health Professional Advisory Council, which has come in place with the implementation of the Health Bill Act of 2017. And that will go a long way. Because what needs to happen is that we need to know the numbers, how many health facilities from level 1 all the way to level 6. How many doctors do we need? How many nurses do we need? How many health record specialists, nutritionists, pharmacists? Because when you look at all the numbers that are required, most of the time we just look at the nurses and the medical doctors. But we forget that at the end of the day, the critical masses is in nurses and clinical officers. Plus the other cadres, you cannot go to start dispensing medicine when you don't have a pharmacist, a pharm tech. So all these numbers must run together, and already training this assessment has been done by the ministry, and that will guide as we go to the future.
So is there a need of telling students, you know, this cadre of health professionals is actually full? We need to distribute it equally, so get trained into this health sector.
In fact, when you look at the training opportunities that we do offer as KMTC, you find that most of these courses are highly regulated. You find like nursing programs, we have to train a certain number. Of course, there is the Nursing Council of Kenya, which will come now on board and give the certification in terms of registration for them to practice. So that's an area, of course, it has to be, we are dealing with human beings here. So we are also restricted in terms of the numbers that we are able to produce. Clinical medicine, the same thing with doctors at the University of Nairobi, Moi University, Egerton, and all the other universities that have medical schools. Those numbers are regulated to ensure that we have the right skills and competencies, because it's not just a number, it's not just an issue of churning out numbers, but we need to look at also what kind of skills and competencies are we impacting to ensure that the service they deliver is up to the required standards. Yes.
All right. So is there a need for using like e-learning to address I know you say there's no health workers shortage in the country, but as you speak, several counties are even asking, you know, like, let me give an example of Nairobi County. There's so many county hospitals that actually do not have enough health professionals. So is there a need to use the e-learning program to address the shortage in Kenya?
In KMTC, we already have an e-learning platform. So we are already offering courses, especially those people who are upgrading, people are already working, because there's no way the governments, or especially the county governments, can release these people on full time to come and train. So what we do is that we provide e-learning platform where we'll have 70% practicum and 30% theory, and that is done through e-learning. But that's specifically for those post-trainings. But for the initial trainings, the first level, if you're coming in to do a diploma, we cannot provide e-learning because that's the initial stage where we want to now provide the skills and competencies. And you don't want to take any chances because our training is 70% practicum, 30% theory. So we need to make sure that as these people train, they have mentors, they have seniors within their areas of specialization who will train them both in the classroom and in the practicum sites, which are actually our health facilities.
And you know, Mr. Kipchoge, it's good you've talked about ensuring that the health professionals have the skills. You don't want to take chances. Then which begs the question, so many cases of misdiagnosis has been reported in the country, and so many doctors, nurses, pharmacists are appearing before the board of health workers in the country just to defend themselves. So where is the missing link? Is it during training or is it during the practical part of it?
We do ensure that the training is seamless. So what will happen is that those are few cases that you may hear. And if you look at the cases that have already been adjudicated by the Kenya Medicine and Practitioners Board, is that there are very few cases, which probably is an indication whereby somebody has done not the right thing by having the wrong probably infection, for instance, but all these are not at the training level. Because what is required is that if you look at the facilities are also accredited, and they have to make sure whether it is public or private, they must have the requisite numbers, and the people must produce the right documentations. Of course, we do have cases of, a few cases of quacks. It's good to be honest that sometimes you may have a slip of some individuals saying they have been trained probably in another country and so forth, and so on and so forth. But that should not say that we don't have the right people trained.
So when you talk about people being trained in other countries coming back to Kenya to work, so is there need then to have, a practical training from the sense view that just like the law sector, when you do your law, the doctorate law at a university level, of course, you still have to go to the Kenya School of Law for you to be certified as a lawyer. Is there need also to do that in the health sector so as to get rid of the quacks you're talking about? In the health sector, we already have that in place. What is happening is that the Medical Practitioners Board will actually interview those people. If need, they should be practicum, and they are licensed. So they have to go through the whole procedure. If they are nurses, then we have also the Nursing Council of Kenya. You cannot start practicing in this country without being licensed by the Nursing Council of Kenya. And they look at both the practicum and the theory. Even our own students that we train as KMTC, they also do an exam, which is independent of our training, and they do it with the Nursing Council of Kenya. They also do it with clinical officers of Council of Kenya who will register those. So when you have that in place, you find that there is that check and balances to ensure that there is no loophole in terms of the process of training and also in terms of registration to practice. So when you talk about the shortage, let me not call it shortage because you said we don't have shortage of health workers in the country, but which area in the health sector needs more health professionals?
Okay, the areas where we need more professionals is definitely in nursing. We still need health professionals in clinical medicine. We still also need to have medical doctors in various specialists, really the specialists. The general practitioners, physicians, we could be having enough numbers. But even when you look at nursing, there are areas where we are training nurses also on higher diploma, for instance, in the area of anesthesia, in the area of nephrology, in the area of critical care, especially when now we look at the lifestyle diseases. So we also ensure that the trainings we offer are actually market-driven. And those are the areas that we need to enhance. Look at the area of nutritionists with the life diseases. We are not, initially we were talking of malnutrition, But we now need to look at the other side of the coin. We need to have nutritionists to ensure that we take care of obesity and the rest, so that we have a balanced lifestyle to ensure that we don't run into the risk of what we are talking currently of lifestyle diseases.
All right. Thank you so much, Professor Michael Kiptoo, the Chief Executive Officer at the Kenya Medical Training College, talking to us about training of health professionals in the country. Taking us to another commercial break here on a KTN News Center. If I'm not wrong, it's actually 10:24. We still have a lot lined up for you, so keep it KTN News. We shall be right back with more.
This is KTN.